What do you think of when you think about the fire division? Red trucks, sirens, cats in trees? Well, guess what? We are firefighters, but we also are medical providers. 80% plus of our work is medical, and we are trained both as firefighters and paramedics in our city. What we found over time is that the medical part, there was the emergent side of it, the 911 calls, the cardiac arrest, the difficulty breathing, but really a whole body of work was apparent to us. That there was problems in homes that nobody was handling at all. No one was addressing in the healthcare community. There were people that were living alone without supports, without family supports, that there were people with medical conditions that they didn't quite understand, lots of gaps in care. And as medics, when people don't know what to do, what do? They call 911. So we found ourselves frequently in the home environment with the same people and not knowing what to do, and we decided that we could do something a little different here in Upper Arlington. So 7 years ago, we started a program that we added a service coordination aspect to our fire division, where when we had these calls, we would make a referral to the service coordinator, and they would call them, follow up, and they would start connecting them to some available resources within the community. And we found that to be incredibly effective. But then we started asking ourselves, can we do more? What we found is that a lot of these patients, we were making referrals to our service coordinators, were also complex medical patients or had medical concerns, and they needed an advocate for navigating the healthcare landscape. They were coming home without knowledge of how to, their discharge instructions were confusing. They didn't have a primary care physician, or they didn't have a relationship that would support the best option for them at the right time when they had a medical concern. Our patients that needed help, that had the medical components to them, were often confused about what to do next. And we found by pushing the pause button, adding a medical component of cares to our fire division, adding to service coordination was incredibly valuable to getting our patients into a place where they're healthier and sustaining themselves in their own home and not calling 911 as frequently. And that was their last option. So that's why we found that cares was really important right now, and that's why we added it to our fire division.